Wow, what an opportunity for that family, huh? We'll certainly keep you posted on how that turns out. And a newer type of sinus surgery is helping Capital Region residents breathe a little easier now. It's called balloon sinuplasty, and it doesn't even require anesthesia or a trip to the hospital. A local doctor shows us this simple procedure that his patients are calling a life changer in tonight's Your Life, Your Health.
It's as thin as a toothpick, the balloon.
It can be expanded.
No bigger than a bean pod, but it's strong enough to microfracture bone, expanding the blocked sinus cavity, almost like a cardiologist opening up an artery around the heart.
I think it's great. I do, because people bounce back much faster. I've had people who go back to work the next day.
Dr. David Martin was the first ear, nose, and throat specialist to do a balloon sinuplasty in the Capital Region about 6 years ago. He says when medicine fails to help those with chronic sinusitis, this surgery could mean relief.
In the past, what had been done was we would find the opening and then take biting instruments and bite pieces around the opening to widen it that way, removing tissue. With the balloon, all we're doing is threading this balloon gently into the sinus opening and expanding it.
The whole procedure.
And once it's fully deflated, it can be retracted, back in, and removed from the nose.
Takes under an hour. Studies say an estimated 37 million people are afflicted with sinusitis each year, making it one of the most common health conditions in America. Symptoms of it are the inability to breathe well or taste things, constant pressure in the ears, chronic dripping of mucus down the throat, sinus headaches, and infections. Dr. Martin says the success rate of balloon sinuplasty is in the 90th percentile.
The success rates are typically measured on people's quality of life afterwards compared to beforehand, and the vast majority of people do quite well afterwards.
In Schenectady, Julia Dunn, CBS 6 News.
And we want you to know that balloon sinuplasty, while hugely successful,
Right.
apparently so, isn't for everyone, because the experts say that severe sinus issues may need to be treated with a more invasive surgery.
It's interesting to see the new technology at work, though. It seems
Amazing.
better than actually taking parts of your sinus out.
Yeah, I mean, if you can leave everything intact, it's got to be
That's the
better,
way to do
right?
it,
A little
right.
pressure, that's all, just a little pressure.
That's it. There's still more to come as CBS 6